Dr. Janice Fitzgerald, Chief Medical Officer of Health. The Honorable John Hagee, Minister of Health and Community Services, is joining us via Skype from Gander. Please stand by. Our news conference will begin shortly.
Good afternoon, everyone, and we will start our media availability today with Dr. Janice Fitzgerald and their update for today.
Thank you, Premier, and good afternoon, everyone. Thank you for joining us today. Since the media availability yesterday, we have no new positive cases in the province. So the total number remains at 261, with 243 cases in Eastern Health, 8 in Central Health, 4 in Western Health, and 6 in Labrador-Grenville Health region. 52% of cases are female and 48% are male. By age, we have 22 people under the age of 20, 38 between 20 and 39, 39 between 40 and 49, 58 between 50 and 59, 57 between 60 and 69, and 47 who are 70 and above. 3 people are in hospital due to the virus, and of these patients, 1 is in intensive care. 248 people have now recovered, and in total, we have tested 10,275 people. COVID-19 has had a profound effect on all of us, and nobody is immune to its impact. It has uprooted our daily lives and routines, forced us to distance ourselves from our family and friends, and left us with uncertainty. Yet, throughout this entire ordeal, I have been struck by the commitment of Newfoundlanders and Labradorians to do what is right, even when doing so is not easy. We are where we are today because of the efforts we have each put forth to control this virus in our province in the last 2 months. I know it has been difficult and has come with great personal sacrifice, but on days when we feel like throwing in the towel on COVID-19, I hope we can each find renewed inspiration in the successes we have shared to date and move forward again with fresh resolve. We owe it to ourselves and to each other to see this through. Today, I'd like to announce that we have expanded our testing criteria. So people who have any 2 of the following new or worsening symptoms should contact 811 for follow-up and arranging testing. So the symptoms are fever or signs of a fever, which could include chills, sweats, muscle aches, and lightheadedness, cough, sore throat, painful swallowing, headache, runny nose, unexplained loss of appetite, diarrhea, loss of sense of smell or taste, and small red or purple spots on your hands and feet. Again, if you have 2 or more of these symptoms, please call 811 for further direction. Overcoming this pandemic will take our combined efforts, but every action counts. Please continue to do your part. Stay at home as much as possible, especially if you are ill. Cover your coughs and sneezes. Practice proper hand hygiene. Maintain a safe physical distance of at least 2 arms lengths from others while in public spaces, and wear non-medical masks when that is not possible. Practicing these measures is for your own protection and for that of the protection of others. It may not seem like it right now with our slow and deliberate approach. We have actually turned the corner on this wave of COVID-19. Though we must tread carefully to prevent new outbreaks, as long as we move forward responsibly and at a reasonable pace, we will regain some of the normalcy we have lost as we wait out the end of this pandemic. While our movements may seem slow, we must remember that it is often small steps and not giant leaps that bring about the most lasting change. If at some point we do have to re-implement measures, it will not be because we have failed, but perhaps because we may have acted too quickly. If this occurs, our provincial public health system will be there and ready to respond. But let us continue to work together and try to prevent this from happening. As Newfoundlanders and Labradorians, we have faced this pandemic in an extraordinary way with courage, compassion, and tolerance, qualities that define our spirit and our character. Overcoming this pandemic will take time and patience, but I can assure you we will get there, and we will do it together. So hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald, and good afternoon again, everyone. Well, I guess we've officially hit about 1 full week of no cases of COVID in Newfoundland and Labrador. And as Dr. Fitzgerald has mentioned, over the last few days, we are heading into the May 2-4 weekend, and we appreciate that as the weather gets nicer, physical distancing is becoming frustrating for some. We know you want to get out, it's kind of normal, and do activities that you were used to doing at this time of the year. But it's extremely important to keep in the back of your mind to think about the public health measures that are in place before you make any quick decisions. Some might think that we are a little too heavy-handed when it comes to stopping the spread of this virus and protecting the residents of our province. But what we do know that if we will continue to take every precaution and know that the public health officials are there to respond, as Dr. Fitzgerald has just said, that every health measure will continue to protect and support you, and we will get through this. We are not prepared to risk people's lives for the sake of going back to what once was a normal way of life for just having some fun on a long weekend. So please do not look for loopholes. Continue to protect yourself, and ultimately this protects your loved ones. So it's about being responsible and safe over a long weekend, and this will bring positive results for weeks to come. We do not want a step backwards. So let's move forward together. Our goal here is to get to alert level 3. Now, over the last few months, as residents of our province have been weathering this pandemic, we have continued to work extremely hard with all levels of government to put initiatives in place in all areas to further support you and your families. These supports are meant to ease the burden of financial hardship that this virus has created for many households and businesses across Newfoundland and Labrador. An example of this is some of the additional supports myself and Minister Cody announced this morning, where we just put in $50 million in financial measures, which will be available to electricity customers who have been negatively impacted by the virus. We are supporting you through a number of actions. The first one is through a one-time credit on electricity bills for residential and general service customers. So this would include the businesses and other organizations whose rates are based on Oil-to-Route fuel costs. So this credit on your electricity bills is just 6 weeks away from coming into effect, and this will vary based on the customer's usage. So to get this moving, what we've done is we've requested that the Public Utilities Board adopt a policy for the credit, and that would be dispersed immediately and it would be done upfront. So the reason for this is so that we could help residents immediately when they need it the most as we deal with the pandemic in our province. Now, secondly, part of the announcement this morning was about on your electricity bills. We're providing $2.5 million to waive the interest on overdue accounts. So if you are a resident or a general service customer, as I just mentioned, who require some flexibility, this may apply for you. So in essence, what this means is that customers who have found it very difficult to keep up with their electricity bills lately, you can now breathe a little sigh of relief. Some relief for you is on the way. So the interest waiver that I've mentioned will come into effect on June 1st, which is just a couple of weeks away, and that interest waiver will be available for 15 months. Now, we already know that Newfoundland Hydro and Newfoundland Power, they've identified some residential and business customers who are facing some challenges paying their bills, and they want to assure you that you will not be disconnected if you encounter these problems. But we also know that customers will be required to make agreed upon monthly payments and to keep your accounts in good standing. This one-time credit and the interest relief, as I've mentioned, are further steps that we are taking to help ease the steps and pressure that you and your family may be feeling as a result of this pandemic. It is about providing the supports to make life a little easier during some of the toughest times in the history of Newfoundland and Labrador. So it's over a $50 million program that will be rolled out in the next few weeks. So as a province, we are doing everything we can to support you, and we will continue this work on your behalf, as supporting you and protecting you has been our number one priority. One of the ways that we're doing this is by working with our federal colleagues. Many of you would have heard me say, and as in questions, is that we're on a call with the federal government every week, and there it is where we raise issues that affect Newfoundlanders and Labradorians. This includes conversations around the province's fishing industry. Our concerns have been heard by the Prime Minister, and about 1 hour ago there was an announcement of some $470 million to support fish harvesters. This will go towards the creation of a fish harvesters benefit. So how does this help you if you are a fish harvester? If you're expecting a 25% drop in income this season, you will get support to cover 75% of your losses up to $10,000. So secondly, that was announced this morning for those who do not qualify for the Canada Emergency Wage Subsidy. Well, this program has been around for a few weeks now. The federal government is now introducing an additional non-repayable, these are grants, for up to $10,000 for fish harvesters who own their own business. So this will help support harvesters now and help them bridge to better times. Now, I know many of you, as a fish harvester, you've been worried about, what will happen next year. And the federal government has heard your concerns and will change the employment insurance rules. So this means that if you're a fish harvester, you can apply for EI benefits, but that will be now based on your previous year's earnings. So that was an additional $470 million, as I said, that was announced today. But that also does not include the $62 million that has already been announced in late April, and that was the fish harvesters benefit, so included with the Canadian Seafood Stabilization Fund. So two initiatives, one for $470 million today, and in addition a few weeks ago, $62 million for seafood processing. So that fund was about the processing sector to help mitigate the loss of markets for fresh seafood. So all of this information, there's quite a bit of it we give out here every day. You can still go to our COVID website at gov.nl.ca/COVID-19. So go there to look for the information on today's announcements. Also, a few days ago, we laid a foundation how we would live with COVID-19 in Newfoundland and Labrador. So we are now at a time where we think about a new way of living with this virus. You've heard us talk so many times about how we cannot wait this virus out. We must adapt our lifestyle to what will be a new normal. So we have been cautious and continue to be responsible for our actions. That is evident in some of the results that we're getting. We all recognize that our health is way too important. So thank you, Newfoundland and Labrador, for being responsible and cautious in your approach to dealing with this pandemic in our province. With that said, I will now turn it over to your Minister, Minister Hagee, for his remarks today.
Thank you very much, Premier. And again, no new cases in 1 week with a flat line is really good. Not something you usually hear from physicians. It's been really a stellar performance, I think, by Newfoundlanders and Labradorians to get us this far. Premier referenced sources of information, particularly around the new announcement for fish harvesters. But I would go back to one of the other things that we have emphasized from the outset of this, and that is essentially that we have collated and compiled and put together for you a source of trusted information. One of the challenges still is level of misinformation out there, and this causes difficulties with expectations around where we would go. So COVID-19 is the page on our government website that will provide you with information around travel, information around exemptions. Yesterday, the topic was around resources for women, particularly suffering intimate partner violence. Under our resource tab there is a whole bullet of support for people who are experiencing interpersonal violence. And that includes a breakdown by region of all the contact numbers for a variety of community and government-sponsored groups who can assist people in a time of challenge. Again, I would urge anybody to use that for their first port of call for any information around COVID and our responses to COVID. Dr. Fitzgerald has mentioned the increase in the number of criteria that Public Health Agency of Canada are now using for recommending testing. There are now 10 instead of the previous 7. We still hold that any 2 of these are a reason for you to call 811 and make arrangements to have an appropriate test. Obviously, till the result of that test is back, then depending on advice from public health thereafter, you might have to self-isolate. But certainly, until you get the result of the test, you should do that too. One of the biggest challenges that we have in a province and across the country is for those of us who do have some testing capacity is how best to use this. We have expanded our criteria only on the basis of those groups for whom there is clear evidence that a diagnostic test is useful. So we've used it for people who would be transferring from acute care to long-term care. We've used it for healthcare providers who don't have symptoms. And we've been fairly liberal within the realms of what actually makes sense for using this test. Our discussions now is about what we should do going forward that will help us with testing in the sense of where do we use it and how best makes sense because of the controversies. We don't have a screening test for COVID-19. This is one of the three areas of control that we have now. We have reached a trough in COVID-19 of where to go next. The other two mainstays are around social distancing, physical distancing, and the use of non-medical masks. And we continue to emphasize that because at the end of the day, that is going to be something we can each do to protect ourselves and to protect others. And the other is around border controls. And we've had extensive discussions both in the media and here in this event over the preceding weeks, and indeed a really good debate in the House of Assembly. And we find ourselves aligned with the territories and at least two of our local neighbours in having very strict border controls. One of the other things around distancing, we've had some correspondence from the retail sector. Our essential stores are finding with the prospect of relaxation that shopping is now becoming a little bit more of a family activity than it was 3 or 4 weeks ago. Again, unless you have special needs, and we've talked about those too, for people with handicapped, with disability or an approach whereby they would need a support person, then we need to look at providing that. So one person per cart per household, where at all possible. But if you do have, visual issues and need a support person, then, don't judge if you see two people at a cart. And again, there are parents who have challenges with parenting in the absence of supports of their own and have to take young children with them. One of the other activities, and we've mentioned COVID-19 in relation to May 2-4 and the traditional start of the holiday seasons here. We're in grad season 2. My own district, we've had 2, and we have one more to come weekend after this. Safe grad this year, though, is a physically distant grad in your own bubble. That is a challenge, and some communities have shown great innovation in how to deal with that. But again, Dr. Fitzgerald has been very clear about what she means about gatherings, and that is not having a beer on a patio or in a shed with a group of however many people who are from outside your bubble. So again, to re-emphasize what Dr. Fitzgerald has said, we need to hurry slowly with this. If we rush this, we run the risk of wrecking it. So stay in your bubble, bigger as it may be, protect your bubble, and don't jeopardize, don't damage anybody else's bubble. If we can do this, and as Dr. Fitzgerald says, hold fast, then alert level 3 in June is a realistic proposition. So with that, Premier, again, I'll take my seat, as it were, and turn it back to you.
Thank you, Minister. We will now open it up for questions from the media.
Thank you, Premier. For the benefit of our speakers, we have 6 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Please do not press *1 until your name has been called. Following this, should time permit, there will be an opportunity for single questions. This call will end at 2:59 p.m., and further questions can be emailed. Our first questions today are from Peter Cowan of CBC News. Please go ahead.
Premier and Minister Haggie, we've heard from the Premier of New Brunswick talking about an Atlantic-wide bubble saying it may come June or into July. Where do talks stand with other Atlantic provinces about doing this, and is this something that Newfoundland and Labrador will be participating in?
Yeah, so you're right. I mean, there's been some discussions amongst PEI and New Brunswick who've been, they've been a number of weeks now and not having any new cases, and we've been now literally a week here in Newfoundland and Labrador. Nova Scotia is in a very different place. So there's been some, very early discussions on what it would look like for the movement in around Atlantic Canada, as an example. This would be, certainly later in the summer. This is not something that's being considered now. And none of this, as I said to my colleagues in other provinces, can ever be considered in our province without the support of public health officials. We understand that, one of the ways that the virus could get back into Newfoundland and Labrador is through travelers. So we put in place some very strict measures on traveling. We know that's difficult for Newfoundlanders and Labradorians, but all of this is based on measures and advice that will come from public health officials. This is just something that's in very early exploration days. And as I said to my colleagues yesterday, talks around July 1st and so on. This is not something that we see will be possible here. And I think Nova Scotia feels the same way. But, it's just about some early discussions of what the future could look like. But all of this is based on the advice from our public health officials.
If the numbers for here have been very similar to what we've seen in PEI and New Brunswick in terms of low levels, as you said, Nova Scotia is in a different position. If PEI and New Brunswick are ready to bubble together, why aren't we ready to join them?
Because we need to make sure, as been mentioned already several times in even today's media availability, is that this has to be done cautiously. We also know that if you look in some provinces, a little further, west of that, we're seeing some extreme and increasing numbers on a daily basis. And the impact that is having on the long-term care facilities in, other provinces like Quebec, we've seen, unfortunately, in Nova Scotia as well, and in Ontario. So this virus is still within Canada. As we open up our borders, we run the risk of reintroducing this into our province as well. So we've invested a lot of time and energy into, dealing with some very good public health measures within Newfoundland and Labrador. We do not want to lose that momentum. We do not want to expose our province to an undue risk of reintroducing this virus, which is already here, by the way, but slowing the spread down. So we do this cautiously. We understand that people do want to move around, but health and safety is the primary focus for us.
Can you give us an idea how many people have been turned away at the borders so far, and give us an idea of how that's worked? For example, if someone arrives on a flight, do they then have to buy a last-minute ticket for the next flight out? What have you been doing there?
I don't have that information with me today. I don't know if the minister would have it, but this is, what we know is that we put the proper measures in place so that if the enforcement officers, they want to utilize and take advantage of that option, that enforcement ability is there right now. For us as a province, we always saw this as a last resort, education and just getting the information out there so that people would understand, what rules apply to in Newfoundland and Labrador if they decide to come to our jurisdiction. That is one of the reasons why I think public health officials have done a very good job with its exemption orders now online, refillable online, so people, when they make a decision to come to Newfoundland and Labrador, they know it. They should have an understanding of the environment that they're looking at traveling into, and therefore, if they fill out the exemption orders, they will have for certain know that if they will not be turned away at our borders. And I know there's a large volume of requests that are coming in.
Our next questions are from Ben Murphy of VOCM News. Please go ahead.
Thank you. Dr. Fitzgerald, I asked about those red and purple dots on hands and feet as a possible symptom a few weeks back, and you said it wasn't at that time. I know things do change daily, but what changed here to need to expand the criteria like these dots and stomach issues like diarrhea?
So, as I say, we're constantly watching and looking at criteria, and certainly there have been reports elsewhere of these types of post-inflammatory syndromes, I guess, that you could get. So, we wanted to make sure that we were casting our net as widely as we could to catch as many cases as we could. So we decided to use that as a criteria.
And have we had any people showing up here with these types of symptoms at all in the last few days that we've maybe turned away in the past?
So I'm not aware of any, but of course, I wouldn't be aware of every person that's getting tested or what their symptoms might be.
I think,
Premier,
Ben, that's a very,
sorry?
very useful. No, Ben, I just wanted to use that opportunity to emphasize the fact that when we changed the testing criteria on previous occasions, we have said to people who may have had a symptom on the new list that wasn't on the old list that they should once again go back to 811 and seek advice. And I think this is just a really good opportunity to re-emphasize that message. So if you do have somebody who's listening today who has one of those new symptoms, or maybe two of them, then that would be a trigger to include yourself in a call to 811. So don't let the opportunity pass you by.
Okay, thank you. And Premier, I couldn't help but notice yesterday that updated COVID numbers in the province are being shared by at least one cabinet minister on a completely red background with a Liberal Party banner. Is this really appropriate right now, putting that Liberal stamp on the work of public health?
I think what was shared there, and I did see that, I think what's happening there is that we're seeing the Liberal Party of Newfoundland and Labrador, they share these COVID numbers with people across the province as well. And I understand this would probably go through email or through Facebook channels. So this particular cabinet minister, I think that you're talking about, just shared, I think, the information that would have been on his personal website through the, just shared the one that came from the Liberal Party. I know for me, what I do is we just create our own page, but people use various mechanisms, and I think this was just really just sharing of information that would have come from the Liberal Party of Newfoundland and Labrador.
Okay, thank you.
Our next questions are from Kellyanne Roberts of NBC.
Economy in a great way. So for us right now, we want to see some fairness and get back to the table and see that they can, get these people working back safely during the summer.
Thank you. Minister Haggie, you noted the surgical procedures yesterday and the total that's so far been backlogged, essentially. With the delayed procedures, what's the collateral damage to residents of Newfoundland and Labrador and to patients who are waiting?
There has been an ongoing review since the state of emergency was declared and since we actually reduced all elective admissions, because what we said was to the clinicians, you have the liberty, the leeway clinically to decide who is urgent and who will not wait. And we have continued procedures at a rate of about 20 to 28% of our normal throughput. Those, I would assume, would be those procedures that surgeons and specialists felt had to carry on because of a degree of clinical urgency. I have not been made aware of any adverse effects of waiting because, again, my understanding is that these lists, the people waiting, are reviewed on a regular basis by the clinicians. And if it gets to a stage where the clinician felt that they couldn't wait any longer, they have been brought in. It's a very difficult metric to calculate. There are data from other provinces, but we've not been able to show the same effect on our wait list.
Thank you. And my final question, we've come a long way in the span of when the public health state of emergency was declared to where we are now. Newfoundlanders and Labradorians are doing everything they can. But many are wondering, what is our end goal? Without a vaccine, what are we trying to accomplish? Are we looking to have the disease completely leave Newfoundland and Labrador? What's our next mission?
So
I would see.
sorry.
Janet,
No.
after you.
No, we are going to have to live with COVID, and that's our goal, is to learn to live with it in a way that prevents or reduces the spread as much as possible, and with as few people being infected as possible, and with as little strain on our healthcare system as possible. And that's going to have to be our goal until we get a vaccine. When we do get a vaccine, then our goal obviously is going to be to vaccinate as many people as we can, and hopefully then get back to a more normal way of living.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Atlantic bubble. Just curious, Dr. Fitzgerald, could you give us what your perspective on it? The Premier is saying that we'll follow health officials' recommendations on this. So, what do you think of the idea?
So I think it's really too soon to make any kind of judgments on that at this point. We've just only recently opened up or loosened up some of our measures, and we don't know for sure what effect that's going to have. The same goes for PEI and New Brunswick. So I think we have to see what will happen, and we have to look at the epidemiology in each of those provinces to see if the spread or the degree of spread of COVID in each of those provinces would support that kind of a measure. But I don't think we're anywhere close to looking at that right now.
And given the fact that one of our primary points of entry in an Atlantic Canadian context would be Nova Scotia, how important does the situation in that province, versus in PEI or New Brunswick, have to be when this sort of, discussion or consideration is taking place?
So, Patrick, I think we shouldn't get really ahead of ourselves here. As I think I've mentioned in my opening comments here in the public, Dr. Fitzgerald has kind of reiterated the position. What I said yesterday to my colleagues was simply this, is that we are now at alert level 4, moving to alert level 3. And there's a 28-day period here, 2 incubation periods of the virus. And, there's a time for monitoring, there's a time for reassessment. But, you only open up your borders when you do not expose your residents to, further spread of COVID within your province. That's our objective. When Kellyanne just asked us what our objective is, that is our objective. And as the minister just mentioned a few weeks ago, we are seeing the impact of COVID-19 on our healthcare system, not by people that have been have tested positive. What we're seeing is a delay in surgery, so it's having an impact on our residents. So we want to make sure, be very responsible, be very cautious on how we move people around in Newfoundland and Labrador. This is really about being responsible and about being cautious and preventing the spread.
So if that's the case, what does that say about a timeline for having, this sort of, in the context of other Canadian provinces, what is quite a severe border measure in place? If we're not talking about being able to have a vaccine for a long time, what is that? I mean, doesn't that indicate that these sort of restrictions would be in place for just as long?
Well, what it will mean is that as we will learn lessons from other jurisdictions as well, we'll make sure that we have tracking and contact tracing in place, that we can appropriately respond, PPE in the quantities that would be required. We have an healthcare system that is prepared and ready to respond. So there's a number of initiatives that we would have to make sure that we have in place. I mean, we will take the advice from our public health officials here on how we allow people to travel into our province. These decisions are very difficult. Let's be very clear about that. But yet they're put in place so we can protect our own residents here. Very difficult decisions, but are appropriate for this time frame.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
Hi, is the government, or the health authorities, I should say, considering at any point during the alert level process in which doulas and other sorts of support would be allowed for pregnant women in hospital?
The issue of visiting and support for non-traditional healthcare providers is certainly something we keep in mind. I'm still hearing from family members who are concerned about loved ones, quite naturally, and indeed from birth partners for women who would be in labour in the coming weeks. The short answer is that it is under consideration. The challenge is, when would that make sense from a public health point of view? Our vulnerable areas are around hospitals. They are both areas to protect and areas of potential spread. So there's risk in going into hospital because you could acquire it, but there's also risk in bringing it into hospital. so you could spread it. I don't see, unless there is something radical in the public health field that we haven't anticipated, that will come with the next level, for example. And certainly when it comes to long-term care, where our most vulnerable citizens are, that may be quite late in our progress towards living with this virus. It's going to be with us for a long time, and it's going to be a slow process. So I think the key here is that everyone has to adapt a little bit, and patience really is a virtue for this.
As a follow to that, in the terms of unending measures, it seems like healthcare visitations generally won't even happen till level 1, if that. And I'm wondering about seniors in care homes. They've been missing their loved ones for a couple of months now. They could potentially face months and months of nothing still, with little light at the end of the tunnel, and quite possibly just dying alone, as many already have. How do you address that problem, which is, a significant enough problem, despite the protection measures?
I think you acknowledge it's a very difficult situation. It's not one that anybody would particularly want to be in. The issues around visitation in long-term care and personal care is we have tried to move to the same social connectedness technologies that we're using here today, such as Skype and the telephone, acknowledging that people who, as they get older, may have some significant difficulties with that. We're trying to work around it the best you can, quite frankly. We certainly have, on compassionate grounds, made exemptions with end-of-life situations. And quite frankly, we've had pushback from staff about that because of the potential or the perceived risk about it. So none of this is easy, and none of this is going to go away in a short period of time. So at the end of the day, you take the best public health advice of the day and see if there are developments and learnings from other jurisdictions that would allow you to do things differently that might improve the situation. But at the moment, there is no magic bullet.
So, Peter, these are not decisions that would ever be made by anyone if it wasn't for the fact that we have a virus and COVID-19 within our province. I think all of us could point to examples of people that we have in our life that are older and are vulnerable to exposure to this virus. And also, I think it would be, I think the responsible thing to do is look at what's happening in other provinces. And we don't even need to talk about other countries. Just look at what's happening in other provinces and see the impact on long-term care sites and seniors in Newfoundland and Labrador. That is not the type of news coverage that we want to see here in our province. And without putting in place those very restrictive measures, we could potentially be in that same position. We can't say with certainty that at some point it will not get in there. What we do know is that if we follow the measures that we put in place, there's a reduced ability for that virus to enter into our long-term care homes. We understand how difficult it is for people not to be able to visit their loved ones in those homes. We do get that. But we also know that there's a balance, that we protect staff, we protect those residents, and therefore we protect our population. As the minister said, difficult choices, but the prudent ones and the safest ones to implement.
Okay, thank you. The Prime Minister has said that national parks will partially reopen next month. Do we have any indication whether that includes any of this province?
Yeah, we haven't seen the list yet, but you're right. Some national parks will open, but with restrictions. These are not talking about, my understanding, of camping and so on. This would be trails that would open up and visitation to some of those parks. So, we'll get this information now, I think, within the next day or so, and we'll see which parks would apply to Newfoundland and Labrador, if any. But yet, this is a decision that's been made by the federal government to open up, some of the parks so that people can use trails and so on. So, but we'll get that list out to you as soon as we get it.
Thank you.
Our next questions are from Elizabeth Witt of All Newfoundland Labrador. Please go ahead.
At the beginning of the pandemic, we were getting daily briefings into the weekend, and a number of weeks ago it switched to just releases. Could Newfoundland and Labrador follow the lead of other provinces and start holding briefings less often?
We're looking at, what options that we have available to us. I mean, there's quite a bit of time that would go into these briefings. But so far we know that people appreciate these daily briefings. But I think over the course of time we might look at different formats. I've mentioned to Dr. Fitzgerald, and I know the minister as well, and I know my own office. We have a lot of meetings, and there's a lot of work that happens behind the scenes, and there's many groups, and I've had this conversation with Dr. Fitzgerald just prior to coming in here. There's many groups that really want to get in front of her and making sure that they can put in place their plans of what living with COVID-19 would be in Newfoundland and Labrador. So I think there's a balance and some consideration that we must look at within the next week or so on how we want to go forward with our daily briefings and how we get the proper information out to Newfoundlanders and Labradorians. And it gives the media the opportunity to actually to speak with me as Premier and the Minister and directly with the Chief Medical Officer on issues related to COVID-19 in our province. So we'll continue to monitor this and see what the next few weeks would look like.
Thank you. And other jurisdictions have made the decision to run their operating rooms 7 days a week to tackle their backlog. But we're going the slow and steady pace to maintain a buffer, I understand. But if the modeling suggests a second wave won't hit till the fall, why not try to get as many procedures done as possible while we can?
The driving, or the brake really on elective planned procedures is not actually where you think it is. The brake is around the availability of PPE and the availability of beds to deal with the surge capacity. When you admit a patient for, say, a bowel procedure, you are looking at anything from 5 to 15 days as an inpatient afterwards. So that bed becomes unavailable for anybody else for that period of time. And so I think you have to realize that as much as anything else, it's what kind of procedures that you would spend your effort and time doing. And again, you've got to remember that our staff within the healthcare system have had no vacation. They were all put on hold to make sure they were available and ready. Normally, in the summer, the RHAs would run down their number of operating rooms, often till after Labor Day, to allow their staff to have rest, break, recharge. You cannot do frontline healthcare 52 weeks of the year and expect people to just continue as if they were machines. So at some point, we have to adopt an approach that recognizes all of those competing factors. Will we get it right? I'm sure that someone will point out how we could have done it better. But the facts of the case are, based on the competing demands of public health, human resources, bed availability, and the risk of a surge, we have to make an educated estimate of how to do it best. And this, for the moment, is a slow and cautious approach. If the situation changes and we have more leeway than we realize, we'll change too.
Thank you. And yesterday you mentioned there was a backlog of 5,500, and can that be broken down by region? And as we go through this, and depending on availability, could people be moved to other RHAs for procedures if they have the capacity?
The short answer to both those questions is yes and yes. We can break it down for you by region. And indeed, certainly from a diagnostic imaging point of view, prior to COVID, there was reasonable mobility between adjacent centres in different RHAs. For example, I'm thinking Gander and Clarenville, which I know from personal experience. Certainly there has been some mobility around, for example, cataracts, which was a topical issue before COVID. The wait times, for example, in more rural centres in Newfoundland and Labrador was 2 to 3 weeks, where people in St. John's were being quoted 2 to 3 years. So I think this is a huge opportunity to utilize better the resources we do on a provincial basis and not just a kind of parochial local centre. So I think the healthcare system will see some significant changes as we emerge from the acute phase of COVID into that more chronic adaptation phase where we just learn to live with it.
Thank you. And you mentioned you could break down those.
You just had 3 questions?
But
I'll
he said he
allow
would
you
answer
to finish this one. I'll allow you to finish this one.
Okay, because he said he could answer it, how the surgery breaks down.
I can, and sorry, I was being a little bit cryptic. My apologies. I didn't mean to get anyone in trouble. We can provide that for you in a chart without any trouble, no difficulty at all.
Perfect. Thank you.
We'll now run through a single round of questions, starting with Peter Cowan of CBC News. Go ahead.
Hey there. I've got a question about when you look at the reason the ban on bringing people in was delayed was in order to work with travel providers. Talking to people who've flown with Air Canada, there wasn't even an announcement until they actually arrived in St. John's telling them about the ban. So why aren't people being told about this before they arrive?
You know, my understanding that information has been provided to the people that deliver those services, like Marine Atlantic here, Canada, and Provincial Airlines, and those are the service providers. So my understanding, this information has been provided to those that deliver that service. And then when you immediately land within the province, there's also officials there to greet you as well and to just remind you of what's been happening. So people that would come in here looking for traveling information, that all that information is available online. So Peter, my understanding is that information is with those people that deliver those services.
The next question is from Ben Murphy of VOCM News. Please go ahead.
With post-secondary colleges continuing to go online classes like Montana CNA have announced, what does that mean for students learning trades where practical experience is required?
Well, in some indications, I mean, you're right. Some examples would be very difficult to deliver online services, for, people that require work that would be in a lab, as an example. You gave a couple examples there as well, but there are many, courses that can be delivered online. That those trades, those people that are doing skilled trades, that they can actually do online as well. So I think you'll probably see at some point here a combination of both. There will be a requirement for, in-school education, as well as maybe a combination of some online courses as well. So you're right. Some things just cannot be delivered online, and many things can. So you'll probably see some kind of hybrid in the future.
Thank you.
The next question is from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. We've talked over the past 2 days now quite a bit about domestic violence. Wondering when we're potentially going to be able to hear from the Minister for the Status of Women in terms of when she could join the panel and speak to some of these issues that are being faced.
Yeah, so I'm not sure if you've reached out to the department for the availability of the minister, but as I've said so many times now in the last few days, all our ministers are available to, speak with the media. I encourage to do that. Now, yesterday I did make some comments in response to a similar question that I had, and it was supported today by the executive director of Iris Kirby House. So one of the questions I had yesterday was about a toll-free number. There's been a toll-free number in the province for some 35 years, and I have that with me here that I can give to, women. I think I will. So there's a number of capacity. There's capacity that we have within our shelters through Transition House. The provincial number is available 24/7, can direct people to where those supports would be. And the number is 1-877-753-1492. And that number has been around for some 35 years. But if you need access to officials within the department, including the minister, I'd encourage you to reach out.
Thank you.
The next question is from Patrick Butler of Radio Canada. Please go ahead.
To families of people who living in the same space as someone who travels back and forth from another province for work, but it resides in Newfoundland. For those people who are in that situation, if they have a spouse or a relative who's doing that, are they required to also have some sort of isolation measures in place as well when they have a family member who is doing that sort of travel and work?
So you're talking about somebody who's working away, coming home. Do their family members have to isolate as well? Is
exactly.
that the question? So what we are asking those family members to do is to actually monitor for symptoms. And of course, if their loved one did develop symptoms, then they would be expected to isolate as well.
The next question is from Peter Jackson of The Telegram. Please go ahead.
When can we expect Dr. Raman to be joining the panel again?
The Dr. Raman, I guess, is available at any time we would need him here. He's been very, I must say, very accessible, very good to work with. Supplied a lot of real good advice. So right now, the plans of bringing him back, I'm not sure if there's a date that would be set, but that would be working with the public health officials. And if there was a point that we felt that there was an update or some information that he could provide to the people of our province. For those of us that know Dr. Raman, he's a very interesting person to work with. He's working with a group of supporting people behind him. Does some great work, and I'm sure he would not hesitate if we made the call to bring him back to this table. But there's no scheduled date, Peter, that we have in mind.
And our next question is from Elizabeth Whitten of All Newfoundland Labrador. Please go ahead.
Would you be able to break down the testing by region?
I've got that.
I can.
Go ahead, John. You might have it. Oh, no, I've got it right here.
Yeah.
So for Eastern.
We've both got it in front of us. Both.
Yeah.
So.
You go right ahead. It's your turn.
All right. Total people tested by region as of 9 o'clock this morning is 904 in Central, 7,485 in Eastern, 491 in Labrador-Grenfell, and 1,395 in Western. If you put that up prorated by population, we could provide you those figures as well. The total across the province tested as of this morning was 10,275. That underestimates the number of tests actually performed by about 1,000, maybe. Certainly, we can supply you that in table form if it helps.
Thank you.
We're going to take 3 quick questions, so please press *1 and the operator will identify you.
The first question from Mr. Ben Murphy. Please go ahead.
Thank you. Premier Ball, food fishery is obviously very popular here in Newfoundland and Labrador. Any indication if this type of thing will be allowed to go ahead, or is this something that's really not even on the radar yet?
We'll see, but I hope so. It will be a big decision. Of course, the federal government would be involved in this one as well. But any food fishery that would go ahead in Newfoundland and Labrador would have to be done in a safe manner. Many Newfoundlanders and Labradorians look forward to this. I know I do too. But yet, only if we can do it safely. But we're still waiting on that decision. I'm not sure one has been made yet, and I know I've been waiting for that myself. So I'll keep checking, Ben, and as soon as we know, we'll share that information with you.
Great. Thanks so much.
Next question.
There are no further questions registered at this time.
Thank you very much. The time for questions has ended. Please join us again tomorrow at 2 p.m., 1:30 in most of Labrador. Have a great evening.